90% of cancer treatment facility in India are situated in the urban area, but still 70% of the India lives in the rural part. Many of the cancer, which was previously the cancer of the Western world, is now getting importance in India. Now you can understand from era where cancer was a deadly disease, now cancer is a curable one. You can do good works by doing it alone, but you want to do great works, you have to work it together.
Hello everyone, welcome to the new episode of OncoDaily. I'm Foorquan Hashmi, and today we have the privilege of hosting Dr. Abhishek Shankar, an incredible oncologist and a wonderful person, Dr. Shankar, and we really appreciate you joining us today.
Thank you for Khan, and it's my pleasure to join this interview session with OncoDaily. So you guys are doing great work. My congratulations and best wishes for all the innovative ideas that you have and that you're going to work in future.
Thank you, Doctor. So, Dr. Abhishek Shankar is an assistant professor, Department of Radiation Oncology, AIIMS New Delhi, India. He is serving as a Secretary General of Asia Pacific Organization for Cancer Prevention and member of Education Committee and Survivorship and Digital Health Study Group of Multinational Association of Supportive Care in Cancer. He is a member of Tobacco Control and Smoking Cessation of International Association for the Study of Lung Cancer. He is the founder secretary of Indian Society of Clinical Oncology, founder and chief coordinator of nationwide awareness campaign, that is Pink Chain campaign. He is also a member of strategic group Asia Pacific Oncology Alliance and also serve as a vice chair of Advocacy Committee of International Gynecologic Cancer Society. He is a country ambassador of India for International Papillomavirus Society. So the list is still very long. I'm going to ask you, very first question, Doctor. Could you please tell us about your specific role and what inspired you to work in the field of cancer care?
So thank you. And specific role, I work like an oncologist, and already have enumerated my role in various organizations that I work on advocacy. Apart from being, I'm a radiation oncologist. So apart from my role in precision radiation oncology, I work in cancer control and prevention. I work on cancer policy. One of the important areas, risk prevention, community-based cancer care, and these are apart from this, I have another role, to work because right now we are working on cancer care pathway in the state of Punjab. We are working on eliminate cervical cancer program. So though, anything which is trying to boost cancer care in country like India, then which can be a role model for learning in other LMICs. I'm just working on this. And what inspired me to work in field of cancer, I got so inspired after joining the cancer specialty, and I had no particular choice. And this is a very common thing that the branches, like medicine, surgery. So when you know about any branch, you become so judgmental, and you are very much sure that okay, I don't have to do this, I don't have to do pediatrics, I don't have to do medicine. But I was not knowing anything about radiation oncology, so I had no, judgment about this branch. So finally, I landed in this. But I can tell you that I became so inspired about joining this branch and realizing that this is a perfect fit to a person like me because it has a highly high social cultural connection, and probably it makes you learn so much about life and helps you to become a better person. And I would like to thank all my cancer patients so making me what I am today. And this is I can say that whatever I do in my life today, you are a part of us, a part of all that I do. And all I want to say that I love and respect you. Probably I rhyme it so well. It's like a poem for them. So, people ask me that, don't you find that this branch is so depressing because you see cancer patient, they're suffering and all. So I take life very positive and I take every difficulties and as a opportunity. And I think I don't follow any pessimism in my life. And probably the solving the problem and helping them in the right way makes me very positive every day. And I'm super proud of myself that by any means, I just landed in the world of oncology that I just cherish every day and every moment.
That's very inspiring, sir. And really, So now let me ask you, since you are in India, I'm going to ask you, like, what unique challenges does India face in cancer prevention, diagnosis and treatment?
Okay, India is a very large country, and we have many states, and which you call each province. And when I talk about the country problem, probably in India there are multiple country in one country. But there's a country in within a country. So if I talk about the cancer burden, there are more than 1.4 million cancer patients every incidences every year. And when I see the patient dying from this, 900,000 patients are dying of cancer every year. And if I talk about the unique challenges related to three domain prevention diagnosis, so common will be accessibility, affordability, and awareness, and healthcare system, which is, because there is so much of variation, disparity, and inequality in access, which is letting the outcome very, very different in different part of the country. And in India, there's you must have heard, well, because patient have to go and travel to the metropolitan city for cancer treatment, because 90% of cancer treatment facility in India are situated in the urban area, but still 70% of the India lives in the rural part. So this is, and more about the trust. Cancer is all about people believe one institution. In India, it is very, very prominent, and over the period of time people just go with the belief, you know and I even, there are change in the facility. There are now better facilities in different part of the country, thanks to the efforts at the individual level, corporate level, and from the government side. But in spite of that, the famous institution in the country, like where I work, in spite of I tell them just go back, you have the treatment facility, they trust the brand. So brand value of institution is too high, so people don't want to go about back. And there is disparity geographical. Coming to the cancer prevention, this is an important area which is needs more focus and need much more attention, but it is a non-glamorous area, and we face, because we need behavioral change. Even a small kind of outcome, you need to work for 20 years, and probably we don't have that much time. We also have become self-centric, goal-oriented people as a doctor. So we don't want to just pass this battle to the another one who can continue. We want the result in quick succession. And the newer emerging risk factor like environment and occupational hazards is too. Air pollution is a too big problem in India, is too high. So we need to work on this. Human papilloma virus, even preventable disease, they are not covering, and the desired population, we need to work on that. And tobacco is and air pollution are the two risk factors which is killing around 2 million people individually, individual risk factors. So we need to do much more this, and cultural barrier, because India is culturally very diverse. We celebrate it. We, as an Indian, tell everybody we have every 50 kilometers, we have change in culture, change in languages. But it comes to make a uniform policy in terms of cancer prevention, it is a very, very, very hard task for any government. So, and I think we need to think about more preventive, and there's so much discussion about why we should focus on prevention or we should go for the diagnosis and treatment. And there is always a debate. Diagnosis, late stages, people also have the inertia. Many of the people know that they have a problem, but they don't go to hospital because this inertia, because of lack of awareness. And probably this kills so many people in this. And the miscommunication, misconception, you must have heard about the forwarded message, WhatsApp messages, which is miscommunication, is killing 100,000, few 100,000 patients in India. And every time people who are influencer want to influence people, and we are all so inclined to believe on the things which is convenient to us. And again, cultural barrier in all the things. And there is a staff, trained staff. We are cancer incidence is increasing, but in comparison to that, their hospital number are less. There are less number of trained staff, and that needs to be done. System is overburdened. You come to AIIMS, and where you have the affordability, that system is not accessible because of cost. When there is a accessibility, there is they are not affordable. So these two things are not related, and we have to come to serve and newer things, because we talk about cancer survivorship. We should have a more wider network of palliative care, supportive care. And I think the major factor, which is I would like that, if given a chance, We should focus on preventive approaches like tobacco, alcohol, air pollution, infection, and obesity are the major causes for cancer. And I feel all of this is preventable. So India is in a better condition. If we can prevent them, we can come to reduce the incidence of cancer in the country, which many of the country can't think about it.
So the next questions are like, are there particular type of cancer that are more prevalent or concerning in India, and what factors contributing to this?
Okay, so in India, if I talk about the female, the most common cancer are the breast cancer, cervical cancer, ovarian cancer, the colorectal cancer. These are the most common cancer. If I talk about the male, head and neck cancer, which is this, many subtypes like but the most common is the oral cancer, and then followed by this lung cancer. Then we have the esophageal cancer, gastric cancer, and though the many of the cancer, which was previously the cancer of the Western world, is now getting importance in India, like endometrial cancer, ovarian cancer, incidences are rise in India. In terms of male prostate cancer, esophageal colorectal cancer, both in male and female, is on rise. So these are the factors, and factors which has contributed maximum is the change in the food habit, which is very, very, you can correlate with the increase rise in the GI cancers in India. If in coming days, probably GI cancer, as like we call it, head and neck cancer, is the most common cancer, taking all subsides together. In the coming days, GI cancers will be more common in male, taking all the subsides together. So, like I said, tobacco and alcohol. And now you can correlate how the US Surgeon General has now advocated that there should be a level on alcohol about, because it has a causative association with seven kind of cancers. Like for tobacco, yes, but yes, enforcement is very poor at the ground level. Same like alcohol, there should be a warning level. And I personally advocate this, because if something is causing cancer, it should be known to the people who are consuming it. So this is these are the various factors which contribute.
Thank you, doctor. So the next question is like, doctor, what innovation in cancer care are most exciting to you, and how they are reshaping patient outcomes? And maybe I would like to ask you to focus on AI and precision medicine nowadays, because everywhere these like mainly I would like to ask you like to focus on these part.
Okay, so AI, I always think artificial intelligence. So probably I have seen you making the best use of AI by the people who has good amount of natural intelligence. So AI is, maybe I think misused, abused, whatever you can say it in today's world. It is a very, very good tool, but the people who know how to use it, it can really make our practices uniform in the low and middle income country, including India, where there's so much of disparity in terms of expertise of the healthcare. It can really make the system more uniform. It can give you a correct in terms of radiology, in terms of treatment decision making. Like you are not sure about, okay, this is a cancer, what should be the first line of treatment. So using the AI tools, even you can use your own data into consideration. There is a remote, monitoring of the patients. There are many useful, application of AI. But still, I will tell you, there is so much innovation is happening in the cancer domain. And you can read that, if you read American Society of Clinical Oncology newsletter on daily basis, probably you will understand how world is changing in domain of cancer care so frequently that they have at least 20 news to share on daily basis. Now you can understand from era where cancer was a deadly disease, now cancer is a curable one, and people have understood that there is a life with cancer, and people are just taking it as a public health problem. It's just like any other disease. And I'm so excited to see the development in terms of technology, drug development, and in terms of prevention. You see that from, the VIA to pap smear to HPV DNA, we are now going to the point of care device. So you just go and you can take the results in the real time. So surgery, from the open surgery with the long stitches and you have a scar. Now we moved to the robotic era where people are doing the scar free. radiation, from the cobalt era, where, apart from the patients, the healthcare workers were at the risk of too much hazard. Now we are talking about the proton beam therapy, ion therapy, chemotherapy has evolved to the targeted therapy, now immunotherapy, and the latest sensation is the CAR T cell therapy. So AI has a very important role. Clinical trials is being done it, and probably you can better utilize the existing system like MRI, CT, and make your decision more uniform. And it will also help in low and middle income country where there is so much of disparity in terms of human resources. It can really help us. And with all these efforts, I can say that few of the cancers, you can see 5 years survival is close to 100% now. Except we have failed in some area like pancreatic, cholangiocarcinoma, but most common cancers, we have achieved so much success, and this we are counting success on daily basis. So that's a great. And probably with the AI tools in coming days, we'll see the whole outcome will be affected, very, very widely, because human error will be minimized to a larger extent. And that will be very interesting and exciting to see.
Thank you, doctor. Thank you. So, what steps are being taken to increase the public awareness of cancer prevention and early detection in India?
Okay, so I think it's exciting topic for me. I just love it. It's in my circulation. When somebody talk to me like cancer prevention, I feel like dancing. So at least you're just focusing on. And I as a doctor, I'm a big fan of social and preventive medicine. So when I talk about cancer prevention, I take all the level of prevention: primordial, primary, secondary, tertiary, which people use it for the primary and the primary prevention and some part of the secondary. So we have a good program started in 1975. Recently we will have some publication really. We have compared the, National Cancer Control Program of 21 countries. We have submitted to the Lancet Global Health. And I think that has an important NPNCD, which call it National Program for Prevention and Control of Non-Communicable Diseases, has an important awareness component, which is about the risk prevention. They have tabulated all the important risk factors. But whatever the awareness focus should be, it's not up to the mark. We need more. Sometimes it's something very important, and it's not sufficient, because as a mindset, all of us oncologists, other people, hospitals, I just have a focus on diagnosis and treatment. So, and at the same time we'll say, like we have a structured and make the uniform, we have a process of diagnosis and treatment, still we don't have a process or a structure for the cancer awareness or cancer screening. We have a framework for screening of common cancers in India, but I think this is related to the three cancers. We have achieved some milestone, but we need more. And the most common thing is uniform messaging. We have worked and published in Lancet about the Asian Code Against Cancer, about the 13 risk factors, but there should be, to support the uniform messaging, because if there is awareness need, the most important point is the right information. If you have the right information, you can just go ahead, and it should be, for the different country, that messaging system should be different. And for India, if we have, like, I have to aware about tobacco to the people, and I have 5 code on which I have to work. We need to work on those codes, which can make the social messaging more uniform. Institution, society, individual are doing, the awareness part. But I will feel that this is 24 into 7, because cancer don't wait for the World Cancer Day. Cancer don't wait for the World No Tobacco Day. But we are so enthusiastic on these occasions. And sometimes I feel that today cancer will be eradicated from India, and whole of the social media, print and electronics are just showcasing that they love cancer. But I would like to, as a personal level, see this affection towards cancer throughout the year. Don't do too much on one day, and rest of the thing, we're just going with the, advertising, either do the surrogate advertising of the alcohol brand or the surrogate advertising of the, Gutka brand. So I don't want that. Please make it a system. And so I always feel, if you want to seriously want to do something with the tobacco or other risk factors, just because you don't see the hazard that a cancer patient undergo during the whole journey. And I have too much respect for them. Being a doctor, my primary endpoint is just to save patient life, nothing. And the awareness part, we lack the marketing determinant. So you can see that whenever you put the any marketing determinants, I think everybody will start talking about that. You can understand with the Angelina Jolie, genetic component is very, very important. But you see the business of genetic, testing and all this before Angelina Jolie announced it and after that. And, I feel so prized. People don't know their great grandfather name, but they know about BRCA and BRCA2 in relation to Angelina Jolie. So this is the best example of awareness. And in COVID-19, we also see that people were so, you know, f- you know, good with remembering all the vaccine, what are the effects, side effects. So I want this kind of awareness, which is the need of the time. And probably I also want to see the first page ad for the cancer care, the risk prevention strategy. But unfortunately, I used to see the pan masala ad on the first page of our, newspaper, which I don't feel good about it because being a cancer specialist, I need to counter that. And probably counter marketing would be a better approach rather than the demarketing approach for the risk factors.
Thank you, doctor. So, doctor, what do you think? How can the global oncology community support the unique needs of cancer patients in India?
Yeah, because I think through LinkedIn and through Twitter, we all are just connected to each other. That is the best thing to happen in the cancer. The oncology community has come to the one platform. We just cherish each other's success. We just support each other whenever it is required to take help. We just go there, and probably unique needs. U.S. Preventive Services Task Force, NCCN guideline is followed everywhere, which is helping the people to just, and that has a larger impact on the patient outcome. ASCO guideline, ESMO, ISCLC, it helps in a many way, like awareness thing that you guys come up with some awareness. It helps people to understand cancer better. Education in terms of webinar training, many of the organization or society are supporting the training, which is making the doctor more capable of dealing with the newer therapies, newer updates, mentorship, grants and fellowships are now easy because some people post it online, some people help it. So now this publications, now you can see more of the multi-centric partnership and publication related to that. Some is in Latin America, some is in India, some is in Europe. So this kind of collaboration has become so popular in terms of this social media era, new research, clinical trials. So these are the things which global oncology is coming together to support each other for a common gain, which is a cancer patient. We learn each other, from experience of each other. And sometimes whatever we have done it in India, it's so useful for the neighboring country or the country in Latin America where things are so similar in respect to our Indian continent.
Thank you, doctor. So let's wrap up our this insightful conversation by knowing what advice would you give to young oncologists and healthcare professionals entering this field of cancer, like oncology?
I probably consider myself young, so I think what to tell about the fellow young oncologists, I will say, because they know everything, and younger generation is so smart and doing great work. Probably they have an access to everything. Like we just go to the library and just find out the journals and the books to read. Now everything on the tip of your finger because you just log in and everything is now. Information is reaching to you. You don't have to work hard to reach to the information. But I always personally feel the critical letter of illness is I. So don't go by the term I, me, and myself. If you want to be good, the wellness starts for we. So this is very, very important message. Let's make a team and work in a team because you can do good works by doing it alone. But you want to do great works, you have to work it together. So you decide you have to good or you have to be great and use the technology. I know it's very annoying to use technology when you're not well versed with it, but it's really make your things so easy, make uniform and tells, help other peoples to work together on the same. So use all the technology tools and software which is required for your job. And there is nothing that makes you happy. Everything, like if you just do for publication, citation, H index, I-10 index, good impact for the journal, after sometimes you will be get bored of everything. What next? You will not find an answer. But there is only one thing which will you will never get bored. That is the power of bringing smile on your patient face with your skill and expertise. And you can believe me, this is so addictive. When you see your patient happy, it's never boring. You will You will always want more in this. So please focus on this. So make this as your primary endpoint if you are a researcher also. And I know this, we always try to make patient life very easy and with the quality of life. This is every physician aim. So try to hear them, try to work with them. And I can tell you, your learning will be complete only if you work with them. So thank you, all my cancer patients. So for this insight, Amy, and just because healthy communities have hope and those with hope have everything. So we have to be hopeful and we can see the change so rapidly. Things have changed in front of our eyes. So be positive and, you know, ready to give everything, whatever a patient required from us. Thank you.
Thank you, doctor. Thank you. Thank you for your great advice. And I really aspire to be an oncologist, and that's really helpful. Thanks a lot for your time. And this was really insightful, doctor. And I truly enjoyed our conversation. I appreciate
Thank you so much.
Thanks a lot.
Thank you, Bhutan. Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.